pedal edema present in the patient. We have not every time shortness of breath is just because.
Hello medicos, welcome to UMed. Myself Dr. Sawan. I came here today with really interesting case. As you are well aware that after a heart attack, that is myocardial infarction, there could be the loss in the function of cardiac muscle, which can lead to heart failures in many patients. So in those kind of patients, they can comes to our OPD with the features of shortness of breath and pedal edema. So today we got a case in our OPD emergency, right? He having shortness of breath, and he also gave us history that he was having cigarette for the long time. So we suspect that it could be COPD. It could be the acute onset of COPD, but we got that investigation like ECG, and we found out that there was STT changes over it, and the biomarkers was positive. So we suspected that it could be post MI CHF. So not all the time the patient comes to our OPD with shortness of breath. It could be only COPD or acute exacerbation of COPD. It could be post MI CHF also. The patient didn't any complain about heart pain because he was not able to differentiate whether he is having pain due to shortness of breath or it could be silent MI too, right? So here is the case. Let's see the video. Actually, the patient has shortness of breath along with bilateral pedal edema. So we were suspected that it could be post MI CHF, but there was no chest pain, severe chest pain, so we didn't see it coming from the first, right? Then we find out later. So post MI CHF can sometimes misdiagnose with acute exacerbation of COPD. So let's see the case in my ICU. Thank you so much.
We have a patient who is 65 years old, comes to my ICU emergency with the features of shortness of breath since last 10 to 12 hours. Okay, so we took a history and we find out that he is suffering from COPD because he was a chronic smoker back then. So we started taking differential that it may be cause of acute exacerbation of COPD. But as we progressed, it was MI leading to congestive heart failure. There was huge fluid accumulation in his lungs. So we checked the legs. It was bilateral pedal edema. It was bilateral pedal edema present in the patient. We had bilateral cracks in the lower lungs lobe, as you can see, and have the acute shortness of breath. So not every time shortness of breath is just because of COPD acute exacerbation, right? It could be due to the MI, post MI CHF. Okay, thank you.